To our third webinar of the National Public Health Week 2022 of the Physical Activity webinar series. This webinar is brought to you by the APHA Physical Activity section, by the Florida University, by the Universidad de Antioquia, Medellin, Colombia, and America's Network for Chronic Disease Surveillance. It's a pleasure for me hosting today's webinar and our guest speaker, Dr. Andria Rusk, whom I will present in a minute. First of all, I'd like to... Today is actually a very important day because today is the World Physical Activity Day 2022. And I'm not sure if some of you know, but the World Day for Physical Activity is promoted through the World Health Organization and Agita Mundo, which is a World Physical Activity Network, a group of international government and non-governmental institutions who strive to disseminate the benefits of adopting a more active and healthy lifestyle by practicing some physical activity daily. Basically, the movement originated in Brazil, in Sao Paulo, in 1996. And this program basically led later on to the development of the annual Physical Activity World Day, which is always celebrated April 6th. So happy World Physical Activity Day to everybody who's present at this webinar. This is how much physical activity we should have across the lifespan. So we should start at very early age. So we should start in childhood and as children, adolescents. Then basically the older we get, the more important as well physical activity becomes. And if you're older adults, we need at least twice per week muscle strengthening activities and at least 3 times per week other activities for balance and strength. But everybody of us should reach at least 150 minutes of moderate intensity physical activity per week. And every minute counts. This is to remind you how important physical activity is in our daily lives. As today's webinar is on equity, I just want to show you 1 or 2 slides about some factors we may address or may not address. This is according to the Behavior Risk Factor Survey data, the prevalence of self-reported physical activity among US adults by state and territory. So we can see that some states have more than 30% prevalence of physical inactivity. Other states are doing a little bit better, but still, as we can see, it's a major problem, a major concern that the low levels of physical activity in the United States. If you have a look at the maps, for instance, according to Hispanic white adults, for instance, comparing, for instance, white with the Black population, this is just have a look at the colors. We have some green, we have some yellow colors that indicate lower prevalence of physical inactivity. But then if you have a look at, for instance, among non-Hispanic Black adults, the color becomes more red. And so we can see already, like georeferential from the map, that there's apparently are some differences in physical activity prevalence between different race groups. The same is basically for ethnicity, the same we can observe for age group, for income levels, for people with an income of below $25,000 per year have more physical inactivity than people who are more than $75,000 per year. So differences exist in different social demographic and social economic indicators in physical activity levels or inactivity levels in the United States. For today's webinar, it's a pleasure for me to present you Dr. Andria Rusk. She brings new research initiatives to the Department of Health Policy Management as part of the Global Health Consortium at the Robert Stempel College of Public Health and Social Work at the Florida International University. Before coming to the Stempel College, she served as co-director of the Global Public Health Program for undergrad students at the Dominican University of California, where she's also an assistant professor in the program. And before that, she served as faculty at George Washington University, Milken School of Public Health. She has spent 10 years in the private healthcare sector, working in the pharmaceutical and vaccines industry. And following her transition to academia, she spent the last 15 years focused on global health. Her current research led to development of the GeoHealth framework that she applies to emerging and pervasive global health challenges and designing interventions to improve health behavior. She has many publication presentations on the subject based on her research in Africa in Latin America. So, dear Andrea, it's a pleasure me having you here as a speaker in our webinar. Thank you very much for accepting. The floor is all yours. Thank you so much.
Thank you so much. No, thank you. It's a pleasure to be speaking with everyone today, and honoring and celebrating a really important week in the year. So good afternoon, good morning. For those of us, I'm actually on the West Coast today. So if you see me sipping my cafe this morning, there it is. That's why. So I am going to be talking about physical activity and equity. And I'm going to go ahead and share my screen with all of you now. Okay. So, okay, can you see the full presentation?
Yes, perfectly.
Great. Okay. So, we are going to be talking about how we can see the forest and the trees, and how using mapping, a great introduction that Dr. Barengo just gave about the relevance and importance of maps when we're talking about physical activity, and I'll be applying that to how to identify and reduce inequities. So before I get started, I just want to show everybody a couple of pictures. Of course, these are pictures of maps. Just meditate on that for just a moment, and we'll visit this again. And there's some other maps, and we'll take a look at that a little bit later. So what are we going to talk about today? I'd like to start by really defining the portion of physical activity that I'm going to be talking about, which are the determinants to physical activity. We're going to have a conversation about defining equity that's discussed differently from different groups. So just for the purposes of this conversation, I want to share with you how I'm using the word. Then we're going to talk about why are we talking about maps? What do maps have to do with this? A little bit of getting lost, a little bit of getting found again, and then my hopes for the path for the future. And I'll end with some cool stuff. So determinants to physical activity. We're all probably pretty familiar with these. I'm going to focus on the environmental ones. This is nowhere near an exhaustive list, of course, but just the ones that are kind of relevant to this conversation. So determinants to physical activity. When you talk about how are we physical, how do we get active in our day-to-day lives? Of course, there's gym memberships and yoga studios and things like that. And that would be an income driven part of that. But there's also physical activity really kind of outside of the formal space. This would be taking your kids to the park, or getting a pickup game of basketball in your neighborhood, things like that. Even going for a stroll down the sidewalks. That's accessibility to green space, or accessibility to safe space, would be a determinant to how physically active you're able to be in your day-to-day life. Of course, I've already mentioned a little bit of income as a determinant. Education is also a determinant, but they're really kind of an interrelationship there. Your educational attainment tends to drive how much money you're able to make. Most of your students paying for a degree, so you know this all too well, or you wouldn't be here. So there is that interrelationship there. So when we're looking at education, I don't want to fall into that trap of, oh, it's because people don't know that they should be physically active. Safely speaking, everybody really knows that. So it isn't a lack of knowledge per se. It's really that education drives how much money you make, drives where you live, drives affording that gym membership. It also changes kind of the cultural norms of the people that you work with. If you have a job that's barely making ends meet, and so you're working two jobs, you're taking care of kids in the meantime, what possible time do you have to try and be fit? It presents a real challenge. And that brings me to the employment type. If you are working 12-hour days, 18-hour days, 2 8-hour shifts in a day, all of that is going to drive your free time and how much physical activity you're able to attain, which again is an income generated component. And then I want to talk about that safety piece a little bit. Street lights, sidewalks, street crime, all of those are determinants to how physically active we're able to be in terms of using green space, using our neighborhoods. Being able to go for a stroll after dinner is kind of some really low-hanging fruit that most of us are able to take advantage of. But there's a lot of places in the world that do not have that. I've lived in some of them where without street lights, without sidewalks, because of the local crime. Even if you live in areas where it gets dark really early in the day, if you live far in the northern hemisphere, it can make all of that more challenging. And then finally, air pollution, traffic, people speeding in your neighborhood, living in a high rise in an urban environment, all of that is going to drive how physically active you're able to be. So back to equity. What are we talking about here? Well, the CDC defines equity is what you see on your screen, when every person has an equal opportunity to attain their full health potential. The WHO takes that a slight step farther to say, yes, being able to attain your full health potential, but also that there is an absence of unfair, avoidable, or remediable differences between groups of people when it comes to being able to attain their full health potential. So what we're kind of talking about here is a level playing field, if you will, that all groups, no matter those determinants that we just looked at, how much money you make, what your educational attainment level is, whether there's sidewalks in your neighborhood, that everybody has an equal opportunity to physical activity in this case. So, okay, 1,000-foot view, what do maps have to do with this? Well, maps have had a role in public health and intervention planning in a really, really, really long time. I wish that this were more of a participatory conversation because I would love to ask all of you who recognizes this map. I'll give you a minute to think about it, but the answer is this is the John Snow water pump map from London. Oh, we have somebody in the chat. Let me grab these guys. Yes, John Snow, exactly. This is the map of the cholera deaths that were happening in London. He was a physician at the time. He was doing house-to-house interviews when all these cholera deaths started to take place, and he interviewed everybody where those little red, oh, excuse me, where those little red dots are. Those are households. And I'm sorry, I can't get rid of my chat screen, but anyway, and he was trying to find out what is common between the people that are experiencing these deaths. You know, what do they have in common? And that was when he was able to determine, oh, they're using this one pump in the middle of their neighborhoods, and so that was the use of a map was able to save lives from cholera in London in 1854. So long-standing history there. But maps also have more relevance for us than just that. They help us see where we're going. So if you want to get somewhere and you have a path before you, you don't really need a map, right? You know where you're going. But in public health, it isn't really that simple. There's economic factors that can get in the way and kind of cloud a relationship between a determinant and an outcome. There's political and governmental factors, policymaking, social factors, cultural norms, and then finally the built environment. All of these things kind of disrupt our ability to see a path clearly towards how to fix something or what is causing a problem. So what happens when you get lost? Well, you use maps. This is what happens when any of us ever get lost in any moment. If it's our grandmother writing directions the old school way, if it's using that iPhone, if you're lucky enough to afford one, if the United States is trying to make heads or tails of a political outcome, which is that map you see in the upper right corner, trying to avoid traffic, or even looking at the density of deforestation in parts of South America. So all of these are kinds of maps that help us find our way. Back to the pictures. These are maps of parks. So all those dark green pieces, you're probably familiar with this. This is what our iPhone maps look like, or Google Maps looks like this too. They're just maps of parks, and you can see 4 different sections. So we have a lot of park in the upper left. We have a lot of park in the upper right. We have almost no parks in the lower left, and almost no parks in the lower right, with the exception of that one that kind of bisects from the southwest corner to the northeast corner. So what happens if we look at cardiovascular disease mortality? Let's go back one more time. I'm going to go back one more time. So where you have the darkest red is where you have the highest mortality attributed to cardiovascular disease. And where you have that really pale pink is where you have the lowest rates of mortality to cardiovascular disease. So much better outcomes and less disease prevalence. And when you see these maps on top of each other, take a look at the upper left for just a moment. It kind of lines up right with the parks. And take a look at your lower left, where there's no parks, a lot of cardiovascular disease. Now I want to draw your attention to the lower right map. This one's really interesting. See that green park that goes right through the center from the bottom left to the top right? Now look at the cardiovascular disease mortality. You see that white streak that follows the parks? Yeah, I don't think we're in coincidence territory anymore. This is really showing the relationship between having access to green space and how it improves your overall health. And we're going to tie that conversation to equity in just a minute. So here's another one. This is income distribution, where you have the lighter color, you have fewer households living below the poverty line. Where you have that darker green is where you have more households living below the poverty line. So this is a map of poverty, really, and cardiovascular disease. So take a look at that upper or that far left one first. So you have no disease kind of through the middle and then more disease across the southern edge, poverty. And in the center, high concentrations on both. And then on that right corner, yeah, makes sense. Not a lot of poverty, not a lot of disease. So here we're kind of layering all three of these maps together to draw the relationship between access to green space, cardiovascular disease outcomes, and poverty. So where are we going with this? I did a little bit of digging, and you're probably all familiar with this, but the cities on the left, these are the top 10 cities in the United States with access to the most green space, the most intentional park areas. And then on the right-hand side, these are the top 10 fittest cities in the United States. The people that live there have the best health outcomes, they have the longest life expectancy, they have the lowest BMI. And I have highlighted in green the redundancies, where you see the cities showing up in both lists, which is kind of illustrating the point we just made with the maps. But seeing that map data gave us enough information to go on to dig a little bit deeper and find out what's really going on here. And then we're going to do it one more time. These are the cities in the country with the highest percentage populace is obese or above obesity. And then on the right-hand side, these are the cheapest cities to live in the US. So the most affordable, but lowest income, really. And I have highlighted in blue the cities that show up on both lists. So a lot of overlap here. So what we're talking about is how the equity is driving these disease outcomes, that having access to green space is not equitably distributed. It's really the most expensive places to live, and I've starred those on the right-hand side, actually on both sides. All the cities with asterisks show up on the list of the most expensive places to live in the US. So that's Washington, D.C., Arlington, Virginia, San Francisco, California, New York, Seattle. We know all of this already. These are really expensive places to live. Miami is actually on that list, a little bit lower on the list. I think it's 15th, but it's still on the list. And those places that are really expensive to live tend to have more green space because it's expensive. Somebody has to set that up. Somebody has to pay property taxes to fund it, or neighborhoods come together with their HOA dues to pay for it. And you also can't use that space for industry, for parking, for anything else. It has to be designated for green space. And so it's been a hallmark of a nice neighborhood for a long time to be able to have green space. It's actually a luxury in the United States, which is odd. It's not really a luxury other places. It's more normal other places. But here, it's a mark of income attainment and educational attainment as a proxy for that. So if you have to make a lot of money to live someplace that has green space, that's not equitable in terms of being able to engage in physical activity in your daily lives. And conversely, For those populations that have lower educational attainment opportunities, that have low income opportunities as a result, those communities tend to be sicker more often. They also have less access to healthcare. And then on top of that, they don't have access to green space. It's like a triple whammy. Like there's all of these factors that are piling up on top of the same community that are reducing their ability to stay fit, to stay active, and to stay healthy, which again is not equitable. So this is all sounding a little bit depressing. So where can we go from here? So with, well, I apologize. Here we go. Okay. With an understanding of the determinants that we've already talked about and harnessing the power of maps that we've just seen, you can anticipate need, not just react to it, and then plan for change. We're going to take a look at this together. Okay. This is an awesome project done by Esri. They are kind of the mapping gurus, available online. ArcGIS is run by Esri. ArcGIS.com is kind of a free open source mapping kind of interface. I've used that in some of my lecture today. We'll have links for that at the end, but this is what I'm talking about. They started mapping incomes and income disparities, and this is what it looks like. So they're looking at the city of Chicago. So let's take a deeper dive here. All of the cities, all of the dots that are highlighted in orange represent households where the income is less than 25,000 US dollars per year. Okay, then the pink is 25 to $50,000 a year, and the blue, purple, is 50 to $100,000 per year. Okay, the bright blue is $100,000 or more per year per household. They're able to add all of these together, and you could do this with any factors. It doesn't necessarily have to be income, or there's income brackets. If you look at this map and you see, you map your parks, you map your cardiovascular disease, you map your obesity rates, you map your income distribution, you map your educational attainment level, what you would see is a map showing you exactly where you need to intervene to improve people's health. You can predict poor health outcomes just by stacking on top of itself access to parks. Where are their sidewalks? Where is crime rampant? Do they have street lights? Where is low income? Where is low education level? And if you knew where all those things were happening simultaneously, that's where you need to intervene, even if the health outcomes haven't even shown up yet. So you can almost use maps like this to predict the future because we know what's going to happen. We've seen this for too many decades to not be able to see those relationships and to predict those outcomes. Sad, but it's true. But harnessing maps, we have an opportunity here to invest public health dollars in a smart way, to have super high impact with very little investment, because you don't have to run an intervention across an entire city or an entire county. You really can target where the need is the highest and you can do the most good with the least. So that's a future opportunity. So let me pop back over here. So on to the cool stuff. If this intrigues you, if this is a concept or an idea that you find appealing or sexy, here's some opportunities. So Harvard University publishes a new map every Monday. They call it Harvard's Map Monday. The link is right there. I'm sure we can share these presentations after today, and then you can get those links directly. But this is just the neatest way to see what the coolest things that are happening with using maps and solving public health problems. And they do some really fantastic stuff. We're all familiar with the opioid pandemic in the United States, exacerbated by the COVID-19 pandemic for sure. And this is a mapping initiative through ArcGIS where they're able to map that epidemic. And they did something similar to what I was just describing, where they're looking at income attainment levels, where are people suffering from depression, how far are people from the healthcare system, from mental health services and psychiatric clinics and things like that. And then they can kind of show you where you're going to have your next opioid outbreak, if you will. Globalforestwatch.org uses maps. They actually use NASA satellites to look at deforestation, land use change from space. They can even get moisture, rainfall, I think they call it ground humidity from satellites, and they can map all of this and kind of show you where the landscape is changing at what rates. And of course, shoreline movement stuff is included in that. And then mapping part of the Millennium Development Goals with the Lancet. That's an awesome article right there that you can take a look at. Visualizing geographic data using story maps. That's what I just showed you with the example of Chicago. That's a story map, which is a product available from Esri that anybody can use, manipulate, add their own data. And then, of course, I've got to give a plug to the man of the hour, Hans Rosling. Unfortunately, he's not with us anymore, but he was the master data visualizer using maps to tell compelling stories. He has an amazing TED Talk. If you haven't seen it, check it below. And that's it. These are my thanks. I want to thank everybody here, all of the participants. I'm so glad that FIU makes this commitment every year to honor and participate in National Public Health Week. And then I have my little plugs to where my data came from, Esri, US News World Report, which is where the fattest, fittest, most expensive and cheapest cities data came from. And then of course the CDC.
Thank you so much, Andrea, for an excellent talk. And it's amazing what you can do with maps. I remember when I was a kid, I used the map to go from one place to the other. But I mean, it's great to see how much this has been developed. For everybody, the attendees, you can write questions in the Q&A, and we're going to take them in the order they arrive. And there's a first question from a participant said that, would you say that 80% of the issue is improving the environment to provide more physical activity opportunities and only 20% changing behavior?
This is an awesome question. I'm super intrigued by this question. And I'm really glad that James asked this. And as a public health professional where my doctoral training is in health behavior, you couldn't have asked this question at a better time. I 100% believe that if you build it, they will come. And that people want to be healthy. People want to move, unless there's if your physical health is to the point where you're suffering from disabilities, you have something like fibromyalgia that really prevents you from participating in physical activity without a lot of pain. Unfortunately, I know too many people that suffer from that. But outside of those groups, people want to get outside and move, especially people with kids. They know that they want their kids to be active. They just need to find a way to fit it into their lives where it isn't a super heavy lift. And what I mean by that is it's not totally burdensome. I feel like those barriers, distance from a safe place to walk around is really one of the biggest challenges. And if you build neighborhoods like that, you will change behavior. You know what I mean? It's kind of like form follows function. If you design the community that way, then you'll start changing behaviors. And I'm not saying that change behavior programs don't have their place. Of course, I think they do. That's where my training is. So you better believe that I'm committed to that, and I believe in health behavior change programs. But to answer this particular question, I really think that the biggest bang for your buck is build it out.
Okay. Thank you so much for the answer. Waiting if there's any other question. I'm like to ask you one thing. There's a lot of evidence. I mean, with everything you presented, we have the evidence. What are like areas of concern? How much do you think this has been used for taking political decisions or planning policies in public health? Or is this used in order to develop policy to monitor progress in different, for instance, physical activity behaviors? Or how much are they linked with political decision making?
I think that there's kind of two questions in one, I feel. So I'm going to try to kind of parse out one from the other. The first is, the availability of the data and using maps to understand public health problems. I think that's been done pretty well. I think kind of the mapping community has infiltrated understanding where things are, what is currently happening now in a pretty good way. I think where the opportunity has yet to be realized is using maps to predict future problems. We really haven't jumped into that space fully yet, or really much at all, in my opinion. And there's a huge missed opportunity there because the maps are already there. The data is already there. We're kind of letting this data languish, which anybody in public health research knows is a huge no-no. Like you try and milk every single thing you can out of all the data that you get because data is so laborious and expensive. So I really don't think that we've been making the most of the predictability of forecasting need. When it comes to the political machine, I'm going to talk a little bit outside of school here for a moment and say that, you know, I had the opportunity to work in DC for a little while. And the sense that I got was that most actors in that space feel like they already know everything. Can I say that without getting in too much trouble? That there's a real need to demonstrate the problems and the needs and the potential for solutions. And to kind of bring that down to a bit more granular level, there's a lot of advantage that comes from the republic kind of model that the United States is set up with, where we give a lot of power and rights to individual states and then counties and then cities and then communities, which is fantastic to bring the decision making, decentralize it, and kind of bring it local. The problem, though, is that the funding doesn't always follow that way. And it's really difficult to um, get the money and the resources that are needed to invest in these communities when the communities already don't have any money and when it's the local community making those decisions. So I feel like the federal government has an opportunity there, maybe through the park system or something like that, or the Department of the Interior to address some of these problems more directly in ways that communities really can't handle themselves.
Thank you so much. So it's a challenge how to bridge that gap, use the future predictions in how to embed them into the healthcare policies. It's usually in most areas of research the case. So how to implement findings from research into the benefit for the population. Good. Tom wrote that he's in DC, so he's in a healthy district and with parks and with a healthy fitness. Not sure how Miami. I thought Miami is in the bad list, but the bad guys list. But I think we're somewhere in between, so we're doing not that bad as I thought.
Yeah, I mean, pretty high on the expensive places to live list.
Yep.
15th or 16th in the nation is pretty tremendously high. In terms of health outcomes, um, you know, obesity levels aren't as bad as they are in some places in the Southeast, but they're also not as fit as most of the places in the Northwest. I'm actually in Portland, Oregon right now, which is one of the fittest cities on the planet. It also happens to be one of the greenest cities on the planet. And of course, Tom, I see you're in DC. DC also one of the fittest places on earth. And so is Arlington, Virginia, right across the river. When you live in DC, I lived on Capitol Hill, you will see people outside jogging and taking advantage of those parks all day, every single day. Even though DC is a highly diverse area in terms of background, language spoken, country of origin, income level, everything from interns to senators live in DC, and yet they all join in and participate in taking advantage of this green space and making them one of the fittest cities in the country.
Nice. Considering that in winter you have extreme temperatures in Washington, very cold winters and very hot summers. I mean, we could claim here in Miami that it's just too hot, but it doesn't count as an excuse, I guess.
It can at some point. If anybody's tried to work out in the summer in Alabama, kudos to you, bro, because it's not fun. But no, you're right. It only, that excuse only plays to a point.
Good. We have time for one final question from Roberto. He asked, how could you implement parks in highly dense cities like New York?
So New York has actually addressed this challenge kind of head on. Of course, there's the Central Park, which was part of its planning originally. So, okay, they get a little bit of a cheat there, but they also created that skyline, the Greenway. I don't know if anybody's seen that, but they took kind of an abandoned railroad track, or I guess it was a subway track that kind of went up in the air. And it was a big sort of bridge, but anyway, it's called the Skyway. And they got rid of the tracks and they planted it out and they basically gave it like a living roof. And now it's in a completely green space. It's up elevated off of traffic, so you don't have to worry with, you know, taxi cab drivers driving like lunatics or tourists from Wisconsin. Sorry to anybody from Wisconsin. You know, you're kind of elevated up above the city, and it also kind of gets you away from the smog. And And so they've already sort of dealt with this problem. Yes, the Chelsea High Line. Thank you, Roberto. So those are opportunities that cities need to just think a little bit differently about things. And you can do a lot if you have the money for it.
Perfect. We have one more question, one comment. So first of all, Anonymous, can you explain the connection between park placement and cardiovascular disease mortality rates with regard to the maps? If parks take up more physical space and people do not live in parks, how does that affect the correlation in those areas?
Yeah, great question. It's because the CVD mortality rates are per capita. So if the capita is lower and the incidence is lower, it still shakes out.
Okay, thank you. Then a final comment from James. Difficult to create green space out of industrial space, but many communities seeing a lot of vacant retail space, not doing anybody any good if they stay vacant.
Yeah, that's probably true on a lot of levels, not just a physical activity level. But again, with the amount of innovation that is entering the commercial space right now, when you think about like Uber is so ubiquitous in our experience, and yet just 10 or 15 years ago, that was a bonkers idea. Why could we not come up with a pop-up shop gym, at no cost or at a reduced cost in a community? Why can we not do, I don't know if anybody's heard of Peer Space. But Peer Space is where you can actually borrow space in somebody else's house to film your own influencer videos. Can we not do that with empty commercial space and let people pop in? And you can put a CrossFit gym anywhere. They call them boxes for a reason, right? So maybe there's an opportunity to kind of harness some of that vacant industrial space for better use and
Yeah.
cheery up the neighborhood a little bit. It's always depressing to see those boarded up windows.
Thank you. First, thank you so much for your excellent talk and for the discussion. I think this was a great information, and really we had a nice discussion. So thank you very much for your time. I'd like to thank all the attendees to being here today. We record the webinars, and we're gonna let you know once the recordings are there, so you can listen to them again, share with your friends. Also, we're gonna have in 20 minutes a webinar on scalability of physical interventions. You're more welcome to join. It's a different link. And I wish you all a happy World Physical Day. Stay healthy, and see you latest tomorrow for the next webinar. It will be on physical and mental health. Thank you so much, everybody, and stay active.
Thank you.
Thank you.